It's a salvation for humanity. I believe humanity doesn't yet fully realize how lucky it is to have such people as Pasteur and Jenner, who did such a great job in the field.
We focused on one of the areas, which is the creation of a new flu vaccine.
All this knowledge and technologies together, including genetic engineering, let us develop a new approach to production of vaccines. The main challenge is finding the relevant component of each pathogen, which is of the flu virus in our case. It's both necessary and sufficient for the human immune system to recognize and memorize it as a red flag for the flu virus. That means we do not need to administer the full virus. Such a component has been found for the flu virus. It's a cell membrane antigen protein, the so-called hemagglutinin. The remaining task is to find an easy way of delivery of this gene into the body. And for that, we use a special nano container. The value of it is the technological platform. The approach helps us not only to create an innovative flu vaccine, but also to form the technological basis for development of a wide range of different vaccines and pharmaceuticals. And that is the main advantage of the project.
So, let's continue our discussion on the development of an innovative flu vaccine in Russia. Please welcome Professor of the Department of Pharmacology and Pharmaceutical Technology of Moscow State Medicine University, Khachik Sayadyan.
Good morning.
Good morning, Mr. Sayadyan.
Good morning.
Well, let's discuss the opportunities for the development of vaccines in Russia. We've already been discussing it with a previous speaker, and I would like to share my thoughts with you. Some doctors believe that one of the reasons why imported vaccines are not efficient is the time it takes to transport them. A vaccine cultured in the Netherlands or in Belgium gets on the market straight away, and people are vaccinated on time for the current flu strain. And when the same vaccine is shipped into Russia, it goes through a time-consuming customs clearance process, then to the distribution chain, and only then it appears on the pharmacy counter. Meanwhile, the viral strains mutate, and as a result the vaccine may become outdated, and its efficacy is considerably lower than in the US, France, Belgium, or the Netherlands. Do you agree with me?
Yes, you're right. But there's one important factor. Flu strains drift every year. And each year the World Health Organization performs global research to identify the viral strains that are likely to cause a new epidemic. The results are reported worldwide. And certainly, production of the vaccine and immunization takes a long time, and everyone tries to make it quicker. We're planning to complete the clinical trials and launch the new pharmaceutical production facility in 2013. And that will not only reduce dependency on imported vaccines, but also market a new generation vaccine. Our technology allows reducing the time required for culturing vaccine strains by half compared to global competition, preserving and even exceeding the current efficacy and safety standards.
при той же эффективности, иногда и высшей эффективности и безопасности, потому что если в зарубежных аналогах, тем не менее применяется,
Unlike the currently marketed vaccines, we don't inject the infectious agent into the human body. We simply administer an antigen that provokes an internal immune response.
Will the production facility be used solely for flu vaccines, or will there be a broader range of products?
We have a basis for production of different drugs, including pharmaceuticals for the treatment of amyotrophic lateral sclerosis, or ALS, and the pharmaceuticals for relieving toxic conditions arising in oncological practice during radiotherapy and/or chemotherapy. We're constructing our facility in an environmentally safe area, 85 miles north of Moscow. A new pharmaceutical cluster is forming there, with several pharma companies setting up production facilities.
Professor Uchaikin, we know that you're an expert in infectious diseases. So, what is your opinion of this project?
I've always dreamed of a vaccine that would provoke a mucosal local immune response and form a defense against various airborne pathogens. And I was glad to see in your project the idea of creating a set of antigens intended to form a complex for the local mucosal immune system.
I believe that the great teamwork of technology developers, pharmacologists, and doctors will help sick patients defend themselves against viruses and other infections. Vaccination has an important role in maintaining immunity, along with other factors such as diet, vitamins, and stress. I hope that we will soon see a new generation of vaccine available to everyone on the market.